Hello everyone. I am drberkkkaratas. In the Blackboard series, we will talk about penile curvature. I had already shot some videos about penile curvature. It is available on our YouTube channel. You can look at these. I want to explain it in much more detail, but in general in the summary table, on the Blackboard here, as I explain it to the patients. Now there are three shapes in the curvature of the penis. Apart from these, there is no other form of curvature. The first is the posture of the penis, which is the most confused part. Congenital curvature and penile curvature. In fact, the actual curvature of the penis is due to a disease. So there are videos of this, which we mostly call Peyronie. You can watch it in detail. Now the first one is the penis posture. Look, I have a prosthesis in my hand. This is one of the one-piece dentures. In general, the penis can look like this, like this, like this, like this, and like this. The point we pay attention to is that the trunk is straight, from the root upwards. In the same way, it can stand sideways to the right and left. This is a completely normal thing. In other words, you can think of it as the posture of people's noses and the posture of their ears. This is especially the case, there are many people who say that my penis is curved. But this is a normal situation. The main issue we call congenital curvature is actually let's adjust our prosthesis here, such and such an angle of the penis to the down, up or right or left. In this, the main point in this congenital curvature is this. The lines of the penis are straight. In other words, the penis continues to curve after a certain point. I'll show you a little later. It is very different in cases related to the disease. This can actually be confused with penile curvature, that is, penile curvature due to disease. Our third condition, which is the condition that needs to be treated medically, is penile curvature, which is mostly due to Peyronie's disease. What did we say? Peyronie's disease is a calcification of the membrane on the penis. Think of the penis like a balloon. Let's say if one side of the balloon petrifies like this, or if it limescales, or if we pour concrete, that side will not be able to expand. Like, what's going on? Let's do it this way. Look, it looks like this. So there's a plaque of the person over there. There's a plaque here. Since this place cannot expand, the penis turns to this side. In the same way, for example, there is a plaque here, for example, at the bottom, here at the top. We can say that there is a plaque on the right side here, and there is a plaque on the left side here. This is a situation that really needs treatment. Usually, this situation is often encountered. How can we distinguish? Of course, it is very important in these aspects, but if your penis is like this for most of your life, as long as you know yourself, then we can call it congenital curvature. But if it has started to curl like this gradually, there is no such thing at first. For example, if this started to happen after the age of 30, then it may be plaque. You should definitely go to the doctor. Now what are we going to do with them here? So the basic principle is there something wrong with the relationship or not? That's our goal, so we need hard data. There may be some pain, etc., but the important thing here is whether there is a problem in the relationship. You can say there is or there is not. There are 4 things that can already be done. It can be followed. Medical devices can be used to correct a number of problems. Medical treatment can be done. There are solutions such as shock wave and PRP. Finally, have surgery. Let's take a look at them one by one. Now, if there is no problem in the relationship at number 1 and 2, then there is no problem. If it says there is, it should be approached with suspicion. It's just that sometimes the penis is too upright and can't go down. Of course, there is pain here because it needs to be lowered a little during intercourse. There may also be a loss of hardness because there is pain. In other words, there is usually no problem in the relationship with the posture of the penis and congenital curvature. It is followed by pre-curvature. So 1 and 2 are mostly followed. It's just that if there is pain in this way or in that position, it doesn't happen much here. In the first case, a medical device can be used. In other words, in the number 1 case, the medical device can be used under special conditions. Now, if we come to the curvature of the penis, that is, the real curvature of the penis, Peyronie, if the person has problems in intercourse, if he has erection problems, a medical treatment or operation can be recommended. When do we recommend surgery? If the person cannot have intercourse due to curvature, that is, if there is a problem in the relationship, then what happens? We recommend operation number 3. But if the person, yes, can have intercourse, but he has difficulty, his curvature is a little too much, and there is a curvature in his erection, then what do we do? If there are no major problems in the relationship, we plan medical treatment. So actually, this is going to be number 3. In fact, if a person has Peyronie, that is, he has a plaque, if there is a curvature related to this, we definitely do a treatment. If the person cannot have intercourse, an operation can be planned, and during this operation, that plaque is removed from there. Of course, if this plaque is too much, that is, if there is such a plaque, the curvature will be more. Then, of course, there may be hardening losses. Therefore, prosthesis can be evaluated here. Well, you said, sir, I don't want it to be straight like this. I don't want medical treatment either. I don't want to use a device. Because the devices are used for about 4 hours a day for 6 months. Don't want. I'm going to have surgery. Is there a risk? Now there is a system that works normally and healthily. Here, it already has a thin membrane like the wall of the balloon. We have to intervene in that membrane. Here's the biggest problem. Look, for example, we are intervening in congenital curvature here. What is an intervention? Look, this part, this and there are not equal heights. We bring them to equal size. Since we can't lengthen here, we're going to shorten it from here. We're going to remove this place. And then we're going to plant this here. What will happen then? The penis will become flat like this. But there will be a shortening of the penis length. In other words, depending on the degree of curvature here, sometimes 1 centimeter, sometimes 1.5 centimeters, sometimes 2 centimeters short. If, as I said, it usually does not cause a problem in the relationship, if it does not cause problems in the relationship, we do not recommend any surgical intervention. For example, let's say there is a curvature of 10 degrees, we can reduce it to 6 degrees, 5 degrees, and sometimes even 4 degrees using a tool. So we shouldn't get too hung up on that. So that's one of the biggest things. That's one of the obsessions. Let it be a little crooked, straight. So after all, I always say that the penis is already the shape of your vagina. In other words, whether your penis is like this, even if it is straight like this, even if it is even more curved during the disease, when it enters the vagina, it will already take the angle of the vagina. I made a video about it. What video did I have? There are MRI images in the relationship. In other words, there is a video called MRI images of the penis in the vagina. There we can see the shape of the penis in the vagina. So the important thing is whether it takes that shape or not. Do you have pain or not when it takes that shape? When it takes that shape, is there an erectile dysfunction or not? Or is there any pain on the other side, that is, in your partner? That's what matters. If there is no problem with these, if possible, it should not be interfered with in any way. But as I said, let me repeat, you do not have a problem with posture and curvature, but if you want it to improve a little, a medical device can be used. Finally, if there is plaque, it is necessary to do all kinds of medical treatment and to prevent the situation from getting worse by performing treatments such as PRP stem cells into the shockwave plaque. But of course, if the curvature is too much, if you cannot have intercourse, then the operation can be planned. Yes, that's how I explained it briefly. Of course, detailed videos of all of them are available on the YouTube channel. Thank you.